Welcome to the second in our series of demonstration videos for how to use the new SUI Surgery Module of AQUIRE. In this video, we'll be entering a surgery visit for an existing patient. As part of this, we'll also enter the unique device identifier and fetch information from the FDA's Access Good ID database. When I log into AQUIRE and click on the SUI module on the left, I find myself at the patient list. In order to add a new visit to an existing patient, I'll just click on the green plus next to her name. Clicking on the green pencil would allow me to edit existing visits. This time, from the visit list, I'll choose surgery visit, whereas last time I chose consulting visit. Again, the first step is to enter a surgery date. Let's say Ms. Test had her surgery sometime back in July. As before, this automatically populates her age, shown here, and opens an additional series of questions. You'll also see this very important checkbox at the top. By default, this box is checked, which means the patient will receive a questionnaire at 5 weeks post-surgery by email. If she opts out, you may uncheck the box and she will not receive a questionnaire. There is also an option for her to unsubscribe on the email she receives. Now, this first tab of questions may look familiar. In fact, it's the same tab as I completed at the consulting visit, and the information has been imported from this visit. If I needed to, I could update this information, but for the purposes of this demonstration, let's assume nothing about this has changed. Instead, let's move on to the new tab, the Index Surgery tab. As before, you'll see that a very minimum set of information about the index surgery is collected. First, the risk assessment. Yes, we discussed the risks of the procedure with the patient. Next, preoperative antibiotics. Yes, we gave those as well. Now for the type of procedure. In the drop-down box, there are 4 options. 2 of them have a note to enter UDI next to them, and 2 of them do not. If I performed a Birch procedure, I would just complete the remainder of these questions and be all done. For instance, did the patient have a concomitant procedure? If so, I can select the procedure from a drop-down list. I'll then answer a question about cystoscopy and 2 questions about injury or complication. In the case of a Birch procedure, this would be all of the information required about this procedure. If, however, I select mid-urethral sling, which has the note enter UDI next to it, a new tab opens up at the top, the device information tab. Let's call this surgical information complete and click Next to get to the Device Info tab. This tab may look like a lot of information, but in fact, it's not. I actually only really need 2, maybe 3 pieces of information. First, I need the manufacturer selected from this drop-down list. Once I've chosen the manufacturer, a sample barcode corresponding to that manufacturer appears underneath. This helps me locate the UDI number, shown underlined in red here, and the lot number, shown underlined in blue, on the barcode. The UDI is the 14-digit number underlined in red that appears after the 01 and before the 17 on the barcode. I'll enter a sample UDI number here. To reduce errors, I'll actually be asked to enter the UDI number twice. Once I've done that, I'll enter the lot number, which I'm only asked to enter once, and which actually is optional as not all manufacturers provide this on the barcode. After that, I'll click Fetch Details, which will call the remainder of this information from the Access Good ID database maintained by the FDA. However, in this case, as you'll see, I've actually selected a mismatch between the company name and the UDI. The system does not allow me to select a UDI and a company name that do not match each other. In order to ensure data quality, it checks to make sure that the UDI you enter corresponds to the company that you selected. In this case, once I've entered a UDI that matches the company name, I click Fetch Details, and all of the rest of this information automatically populates with the most up-to-date information from the Access Good ID database. It is key to remember that once I click Save and Close, I cannot change this information, so I need to make sure it's the right device for this patient. I should never enter a sample device or a test device because this information cannot be deleted from the database once it is saved. Once I click Save and Close, I return to the patient visit list, and now a new visit, the surgery visit, shows up here underneath the consulting visit. Again, if I wanted to edit this information, I would click on the blue hospital next to the surgery visit. Like the consulting visit, the surgery visit never closes, and I can edit the information whenever I need to. I can add as many surgery and consulting visits as I need to if the patient has multiple procedures. As you'll see in the next video, each surgery visit has associated with it a follow-up questionnaire for the surgeon and one for the patient as well. Thank you for watching this SUI surgery module demonstration video.